And I will now turn the session over to my co-panelist, Dr. Fred Applebaum, who will introduce and moderate our first panel.
Thank you, Sarah. My name is Dr. Fred Applebaum. I'm the Deputy Director of the Fred Hutchinson Cancer Research Center, and I am the moderator of this first session. I'd like to start with a brief definition of terms. All of us start as a single cell, fertilized egg. During the first week of after conception, that cell divides multiple times to form a small ball of cells, a very early embryo, sometimes called a blastocyst. Within that early embryo, there are a population of cells termed embryonic stem cells. Each of these cells is pluripotent, meaning that it can turn into any tissue type in the body: bone, skin, brain, you name it. From that stage on, however, as the embryo develops in utero, cells lose their pluripotency and become committed to one tissue type or another. By the time a child is born, there are no pluripotent stem cells left. Rather, each tissue contains their own population of so-called adult stem cells. Now, that's an admittedly confusing term because these adult stem cells are present when you're born. Perhaps a better term we should use is committed stem cell. These cells are responsible for the repair and regeneration of each tissue. There are, for example, skin stem cells and bone stem cells. You cut yourself and your skin heals. You break a bone and it mends. Now, within the stem cells of the skin, those cells can form multiple different kinds of cells. They can form hair, epidermis, sweat glands, and so they still are called multipotent. Likewise, in the bone, it can form bone or cartilage. But skin can't form bone, and bone can't form skin. The stem cells we're talking about today are hematopoietic stem cells. The term hematopoietic comes from the Greek hema, meaning blood, and poetic, meaning to form. While there are other stem cell therapies that are under investigation, hematopoietic stem cell transplantation is the only form of stem cell treatment with proven efficacy. Hematopoietic stem cells are responsible for forming all blood types and the entire immune system. And therefore, because you could possibly eradicate the blood and immune system and replace it with a normal one, it has the potential to cure virtually every blood and immune-based disorder. And for that reason, as you'll hear shortly from Dr. Horowitz, it's now performed over 100,000 times worldwide every year. Now, transplantation is not new. The first person ever cured of transplantation is Nancy Lowry, who was treated in 1960 at age 7. She remains alive and well today, a happily retired school nurse in Tacoma, Washington. 30 years after Nancy was cured, Don Thomas, the person who performed that transplant, won the Nobel Prize. That was in 1990. And now here we are, a little more than 30 years on. Now, while transplantation is not new, the field has been anything but static, which makes today's meeting on hematopoietic stem cell treatment and disability both challenging and fascinating. In this session, we'll provide an overview of hematopoietic stem cell transplantation, including its indications and expected outcomes. Most of the subsequent presentations you'll hear today will build on this information provided by our two speakers, who are truly among the world's most knowledgeable on the subject. Dr. Mary Horowitz is the Robert Euland Professor of Medicine and Deputy Cancer Center Director at the Medical College of Wisconsin. She is also the Scientific Director Emeritus of the Center for International Blood and Marrow Transplantation Research. Dr. Horowitz will give an overview of hematopoietic stem cell transplantation and its variations, indications, and rates of survival. Dr. Stephanie Lee is Professor of Medicine at my institution, the Fred Hutchinson Cancer Research Center in the University of Washington School of Medicine. She's the immediate past president of the American Society of Hematology and directs our long-term follow-up program. Dr. Lee will describe patterns of recovery of patients treated with hematopoietic stem cell transplants. You can find the impressive biographies of both of these speakers on the workshop website. Following their presentations, I'll join Dr. Horowitz and Lee in a panel discussion to further explore some of the information they share. We welcome your involvement in the workshop. Please use the box below the video on our website to ask questions of the panel. Now, I just want to finally say that because the information that Dr. Horowitz and Dr. Lee is so foundational for everything that we're discussing today, we're going to give them a little longer to speak than what is stated on the program. So with that, I'd like to turn things over to Dr. Horowitz. Mary?